A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well being day and night. Voice of Healthcare, along with a supporting partner, Apollo Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctor, which aims to showcase the diverse interests and passions of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So let's get started with the introduction. I welcome Dr. Ankit Chauhan, Senior Consultant Anaesthesiology, Apollo Hospitals. Welcome, Dr. Ankit.
Thank you, Dr. Ritika. It's a pleasure to have you.
Yeah, I wish you a very happy Doctors' Day.
Oh yes, warm wishes for all the doctors in the country. Happy National Doctors Day. And as I say, I would love to start with a quote that whenever there is an art of medicine is remembered, there is also a love for humanity is involved in that. So this year the theme is let us salute the doctors who have been guardians of the health of the people of the country, and they work effortlessly and tirelessly to bring smiles on the patients and their families. That is the theme for the. With that, I would wish all of us a very warm and happy National Doctors Day. Thank you.
Thank you so much, Dr. Ankit. So, beginning our conversation, do you have any interesting stories or experiences from your medical career that have deeply influenced your perspective on patient care or the practice of medicine?
Yeah, see, if I tell you my story, that I have been working in anesthesia profession for last 15 years. So there are lot many stories, lot many patients they have come across, and they had influenced the practices, and they have deeply impacted in our attitude or approach towards the patient. But there are two stories which I would like to enumerate here. One adult story, adult patient, and one pediatric patient. Both of has been operated at Apollo Hospital Ahmedabad last 2 years back actually. The first patient was like 47-year-old lady. She had a huge tumor which was in the abdomen, I mean stomach area, and that happens to be a 47 kg tumor that we removed here with the help of surgeons and the critical care specialists and the anesthesia team. So that lady, 47-year-old, she came to us with bedridden condition for last 2 years, and no one was having a clue what to do with the patient. Otherwise healthy, fit and fine, no other problems, medical issues with that. But that's the size of the tumor was creating problems in her life. She was not able to move. Everything was dependent on the other person. So after a marathon surgery of like 4.5 hours to 5 hours, we could remove that tumor, and her weight was from 80 to came down to the 40s, and she was relieved. The tumor was benign, so there was no further treatment required for her, and she is absolutely living a normal life. So for that family, they were like very grateful to the Apollo team who have saved her mother's life, especially the children, and made her do her routine activities on her own, which was completely dependent on other person. So that was the one case in which the entire team has an empathetic attitude towards the patient. Same time, the relatives, the children, kids of the patient, and other family members were so cooperative for entire duration of the treatment. They trusted the doctors well, and they had full faith, and that had made the difference in the life of the patient. Talking about the another case, similar case with a pediatric patient. The child's age was 3.5 years, and that child carried a very rare tumor arising from kidney, and that was weighing around 3.5 kg. Imagine a 14 kg child carrying a 3.5 kg tumor in her body. So that was again a very challenging case. A onco surgeon and the pediatric surgeon team, along with the anesthesia and pediatric intensive care, They all help the child to remove that tumor. Not only remove the tumor, child is living normal life after 2 years of the surgery, and no further treatment is required for that child also. So both this patient, again with the cooperation of the family, they had full faith to the team, and with that support and our team efforts, we could make her life, the child's life, to lead as normal as was not able to breathe. So otherwise, that child was not able to sleep or eat properly. Continuously in mother's lap, they were lifting her throughout the day and night. So now, said the child is completely tumor free, living a normal kid's life and growing as good as the other kids are. So these are the two stories which are from recent past, which influenced a lot in our overall practice, which I could remember. Yeah.
Right. So these two stories are very interesting stories, and through these stories, we got to know that first teamwork, dedication, faith, and commitment. Goes a long way, and it all helps in making a patient's life better. So
Yes,
that's
that's
what
true.
I will, yes, that's what I will take from this. Moving on, are there any mentor figures or role models uh, you have had a significant impact on a journey as a doctor?
Okay, fine. So there are lot many doctors, colleagues, seniors, juniors. They have come across throughout this journey, right from the undergraduation to the post graduation and the super specialty training which I had. So if I talk about the doctors, there are few names. I cannot take all the names, but there are few names which I have to mention here. So one of them is Dr. P.K. Singh, Professor P.K. Singh, who is the director at AIIMS Patna right now, under whom I got my super specialty training in transplant anesthesia. So he was the one whose efforts to lift up the doctor's skills and providing an atmosphere to work and nourish yourself was excellent, and I always remain grateful to him to provide those things. So I consider him as a mentor. Another name, if I take, is Dr. Professor Vijay Vora, who is at present at Medanta Hospital in Gurgaon. So I was under him, posted as a consultant, and we were doing liver transplants there. So that was initial days of liver transplants in the country, like in 2010, where it was just started. So at that time, they had developed a very good system to provide assistance to the patient who are requiring liver transplants. He is the another one. Talking about the non-doctors mentors, so I would say two names. One is Professor APJ Abdul Kalam. We know, all of us, we know his dedication as a scientist and as a president of the India, what he has delivered so far. And another name is a corporate, from a corporate world, is Mr. Ratan Tata. So all of us, we know again that the dedication he has given for the upliftment of the business in the country and providing a lot of job opportunities to and talent acquisition from the Indian country. So and stay, they both are like at this age they are working and providing as a constant source of guidance to other persons in the country to keep on working with the dedication and for a longer time. Yeah,
Right, and hats off to all your mentors that have played a significant role in your life. That you are here now, and saving so much lives, so many patients' life with the teachings of all these mentors here. So hats off to you and to them.
thank you
Uh,
so much.
so yes. So is there any message that you would like to give to your fellow doctors, budding doctors, JRs, SRs, and in the
Okay,
same field as yours? Yeah.
fine. As a life as a doctor or being a professional doctor providing service to the community, your commitments levels are too high. At times, you have to keep aside your family, friends, or society to deliver yourself at the best. And this is a cause of stress sometimes. So, I would suggest the top priority for any doctor should be the mental health, number one. Second is to have a good and positive work-life balance. How do we do it? That is an individual thing. So I try to keep frequent breaks from my schedule, regular breaks. That is number one. I try to nurture few of my hobbies whenever I get the time. Like I'm a fond of photography. I like to travel a lot, and rest of the time I spend with the family and kids. That's what I do. You can have your own hobbies, own way of relieving the stress, particularly the work stress, because those who are working with emergency specialties, let's say, like anesthesia or critical care or emergency surgery, so they have very high commitments and the schedules are not very improper to work with. So how to balance your how to balance these schedules is a matter of concern, should be a matter of concern for all the doctors, and one needs to find a way out. That is the message I would say on this Doctors' Day for all of the doctors.
Yes, I totally agree with you, Dr. Chauhan, that you should also take time for yourself to piece things out, to recalibrate, to rethink, and probably you can get a best of everything that you have through these short breaks or the balance that you do in your work. It makes you more empathetic, makes more commitment towards patients and yourself as well. So yes, so I agree with what you have just said. And with this, I would like to end this conversation here, and I would like to thank you and all the doctors who selflessly serve our nation's health. And together we salute your dedication, compassion, and unwavering commitment to our health. Thank you so much, Dr.
Yeah,
Chauhan.
thank you so much, Dr. Ritika. It was nice to have a conversation with you. And again, I wish all the doctors in the country a very happy and warm National Doctors' Day. Good.
Thank you so much, sir.